Good morning, and Happy New Year to everyone. It's the time of the year when we reflect on the past and look to the future and try to live more fully in the present. 2021 was a tough year. When it began, vaccines were in great demand. Lines were long to get a shot. It was emotional for many who said they just wanted to get back to normal, to help protect their loved ones and to allow their kids to get back in the classroom. But the buzzsaw of misinformation intervened, often operated by elected officials who decided the pandemic should be a political issue and not a medical one. As a result, thousands of people have become ill or have died from the virus, and efforts to get more people vaccinated has slowed. These misinformation carriers may be enjoying their moment, but they will be on the wrong side of history. I've been asked more times than I can count, when will things get back to normal? That's a difficult question to answer. What's normal? A world without the virus certainly would give us the feeling of normal, but chances are we're going to have the virus with us for years to come. However, with the vaccines, we can keep it at bay and provide a relief valve to our beleaguered healthcare workers and increase the chances that our children can continue in classroom learning. Vaccinations are the path forward, and getting tested is the right thing to do if you think you've been exposed or are symptomatic. Tests are in high demand as the Omicron variant rages, but appointments are available through our Department of Public Health at revivestl.com. So where are we in this third day of a new year, in the third year of a very stubborn virus? We're at a place where cases are at levels we've not seen since the pandemic began. We're averaging more than 1,500 cases a day. Our healthcare workers are begging people to get vaccinated and to wear masks. And they're seeing the toll it's taking on our community, and they're seeing more sick kids. They're exhausted and they're disappointed. On Friday, the Metropolitan Pandemic Task Force responded to the state's decision to not extend the public health emergency. Letting the emergency order expire takes away the ability to expand health care for more sick patients, said the task force, representing the 4 largest medical centers in the region. As the task force said in its statement, while we all want the pandemic emergency to end, the sad fact is that the number of people newly infected with COVID each day now exceeds past surges. The order allowed expanded utilization of telehealth services, the ability to exceed licensed bed capacity when required by demand, and the opportunity to eliminate barriers to testing and treatment of COVID patients in partnership with the Department of Health and Senior Services. The task force will work diligently with the Department of Health and Senior Services and with the state legislature to reinstate provisions allowing optimal healthcare conditions during the pandemic. There are consequences to action and to inaction. From the onset of this pandemic, proactive action was absent from the state and federal levels, and that's why we're where we are today. Like the Pandemic Task Force, I'm concerned about the expiration of the public health emergency order. Reconsidering the extension would make it easier for our healthcare systems to take care of their patients. My detractors criticize me for always talking about COVID. Give it a rest already, they say. I'm happy to talk about other issues besides the pandemic, like reproductive rights, responsible gun laws, more robust workforce development programs to strengthen our economy, and the futures of our young people. However, I will not do the easy thing and stand aside while the pandemic rages unabated. As a doctor, as a father, as a husband, and a leader of this county, that's just not an option. And that's why we've appealed the dangerous Cole County ruling. And that's why I support a mask mandate that will be proposed at tomorrow night's council meeting. I urge the council chair to allow debate and a vote. It's time to let the county council take legislative action on this urgent issue. A mask mandate will result in less confusion, more compliance, and keep our economy going and keep our schools open. As students begin heading back into the classrooms, some schools are again requiring masks, and some universities are going virtual for the first few weeks of the new year. I know these are tough decisions, and you have our support. Let's be clear. Masks aren't restrictions. They're the path to more freedom to move about, to stay healthy, and look with optimism to the future. COVID is causing its own restriction. Businesses are struggling due to an employee shortage, and much of that is caused by workers coming down with the virus. COVID will shut down our community, or at least slow it down, unless we intervene. Vaccines, masks, avoiding crowds. It's a simple way to work together to control the virus. Otherwise, that normal that we all long for is nowhere in sight. Thank you, and I'd be happy to take any questions.
For people who have been maybe out of pocket during the pandemic or during the Christmas break, doing whatever they've been doing for the last couple of weeks, how would you characterize the seriousness of the situation at this point? When we're talking about levels that are extremely high of virus in the community, where are we, and do you expect it to get worse before it gets better?
So the question is, where are we right now in this pandemic? We have case rates, positivity rates that are worse than they've ever been since March of 2020. This is the worst we've ever been in the number of cases and the positivity rate in the pandemic. The hospital admissions last week were the highest they've ever been. And I don't see this getting better in the next week or two, and I don't think anyone else in the public health world or the health system is expected to get better anytime soon. We have a problem.
I know you're pushing for the mask mandate, but just for clarity's sake, what power do you have and what power does the county have to make these things happen?
The question is about the mask mandate and how it happens. The county council or the county through ordinance has the authority to issue public health orders. The county council is required to approve them, and that's the authority that rests solely within the county. There is also authority that's granted through the state for the Department of Public Health to act independently through state authority. That authority of the county health department to act through state authority has been interrupted by the Cole County court ruling, and we're appealing that right now.
Are there any other regulations that the county is considering apart from the mask mandate? I'm talking about possible curfews or occupancy limits in light of the cases.
So the question is about further restrictions, and I spoke to the public health director this morning. We're not considering any of those. Right now, we believe the path forward is vaccinations and putting on masks, and doing everything we can through social distancing, through masking, and getting people vaccinated to control the spread of COVID in our community. But this is a very serious position that we're in right now.
You talked about in your comments about the virus potentially shutting down the county or at least slowing it down. Are we talking about potentially a shutdown like we already experienced before, or what? Can you context that a little bit?
Sure. The virus is impacting businesses, restaurants, retailers, the ability to provide employees to open their businesses, to take care of their customers. And we're seeing restaurants now closing for days at a time or limiting their hours. We're seeing retailers limiting their hours because they don't have employees to take care of people who come in. And that's not going to get any better as COVID spreads through our community.
So it's not necessarily that a shutdown will be imposed, it's more that a shutdown is going to happen because of the impact the virus is having on the
businesses. Yeah, the question is about the impact of COVID on our economy, and it's already impacting our economy because it's making people sick, and it's causing businesses to slow down their operations, and some of them to close intermittently because they don't have employees to run their businesses. And we're seeing that all over the country.
We're seeing, of course, a lot of school districts change their policies when it comes to masking, social distancing. What additional guidance are you offering as the department, as the health department, to school districts?
Well, the question is about guidance to the health department. From the health department to school districts, we have a work group of school district leaders who meets with the health department on a weekly basis. They discuss their circumstances and what's happening, and our health department provides feedback to their ideas. The school districts have the authority to require masks. They have the authority to set guidelines and restrictions within their schools, and I expect them to continue to do that. We're not recommending that schools close or go virtual. We're recommending masking and quarantine guidelines that very closely follow the CDC recommendations.
I have a two-part question. Last question's for me. What are you all doing to expand access to testing here in the county since we've kind of been overwhelmed all over with
Yeah.
testing? And do you all have enough resources to combat the surge that we are seeing in cases?
Well, the question is about testing in the community, and the Department of Public Health is a piece of that testing. Most of the testing and vaccination is done through health systems, through pharmacies, through the healthcare network that provides care in our community. The County Public Health Department helps with that, mostly for uninsured and underinsured populations. We're very busy. We, like everyone in town, are struggling to provide enough tests for this massive surge of the virus in our community. We'll continue to make those tests available. Our testing operations in the County Health Department used to be, up until about a week ago, used to be walk-in, and now they're going to require appointments, like in the pharmacies and the health systems and the doctor's offices across the community, because the strain in our system, because of the surge of COVID cases, is so big right now. It's hard, not because we don't have enough tests, but we don't have enough people to perform those tests. And when I say we, I mean the Department of Public Health, I mean pharmacies, I mean the entire healthcare system in the county. Any other-
Bottom line, do you expect, you do expect this to get more serious before?
Well, absolutely. I think everybody in the country, every healthcare expert in the country expects this to get much worse before it gets better. Absolutely.
Anybody else? Thank you.
Okay, thanks.